Experts from the World Health Organization have arrived in the Democratic Republic of Congo with supplies to fight the Ebola outbreak. Nearly 100 people are thought to have died from the highly contagious disease. The outbreak is centered in northeastern Ituri province, a remote region that's grappling with a humanitarian crisis. 2 cases have now been confirmed in neighboring Uganda as well. Rwanda has closed its land border with the DRC. The World Health Organization has declared a public health emergency of international concern.
Medical experts and supplies arrive at the epicenter of the Ebola outbreak. Authorities and aid agencies are intensifying their efforts to contain the virus in Ituri, a densely populated region. Congo's health minister issued this appeal to the public.
Make yourself known so that you can be taken care of and so that we can prevent the disease from spreading. That is really the message. Treatment is free. Come and get treated.
The first case has been confirmed in Goma, eastern Congo's largest city. The gold mining region is rife with violence and was seized by rebels in January. The outbreak is adding to the fear and insecurity.
I'm calling on local authorities to intervene. We're really scared because of the war and now because of Ebola. We're really scared.
I'm afraid, like any human being, because we have children at school and they still come into contact with a lot of people, and we don't really know who they might be around or play with. Once they come home, they can infect the whole family.
Authorities in Goma say response teams are in place as they try to reassure the public. But one of the scientists who co-discovered the Ebola virus nearly 50 years ago says the country is susceptible to outbreaks.
Our ecosystem is favorable to the development of all sorts of pathogens. The problem is the weakness of surveillance. Our system is very poor at detecting an outbreak.
Experts say the virus's spread is being fueled by displaced people fleeing war and a decline in international funding, which has weakened detection. The current outbreak is caused by the rare Bundibugyo strain, which has no approved treatment or vaccine. The World Health Organization is calling for international cooperation to contain the outbreak.
Let's get more on this now with Professor Oyewale Tamori. He's a regional virologist for Africa in Ibadan, Nigeria. Professor, thanks for being with us. How worried are you about this current Ebola outbreak?
I'm very worried. I'm really very worried. Yeah, because the surveillance nobody knows exactly the total amount of cases. We're talking about 300, but I'm sure there are more than that. The surveillance is poor, just like Muyembe said, and that's where the problem is. We don't even know where it is now. It's been reported in Goma, it's going to Kinshasa itself. Uganda has also reported in Kampala, so we don't know where next. So everybody's scared.
So you're saying there are probably more cases than they've detected so far. It's thought the virus may have been spreading already for weeks before it was detected. Based on what you know about this outbreak, how far do you think it could have spread?
You see, when you remember that the first case was actually way back in April 25, almost 3-4 weeks ago, the lab did not detect it until almost under 2 weeks, which is May 15. By that time, nobody knows where those were. You can't even begin to talk about contact tracing because this will have been infected since April. Where are they? Where are they gone to? Nobody knows. And remember, that's a conflict area with all the problems that we have in the place there.
This strain of Ebola has no approved therapeutics or vaccines, as we saw in our report just now. How does that complicate the response in trying to address this health emergency?
I think even where the vaccine is available, delivery is a major problem. Not to talk about when there's no vaccine at all. So we have to go back on all those simple techniques of IPC, infection, prevention, and control. But when you don't even know where the disease is, it makes it more complicated. So that's when we say we are scared, just like the people there said, everybody. But we shouldn't panic. It's to make advantage of what we have and start working on that. Already, I think the African Center for Disease Control and the concerned African governments are already taking action.
So it's important not to panic, as you say, but funerals and the movement of people are fueling the spread. With that in mind, what would be the most effective measures to bring this outbreak under control?
Remember, during the Kikwit epidemic in those days, there was what we call safe burial. We have to go back to that. The idea of families gathering to bury their parents, it should not be allowed. The same problem also occurred in in Ebola in 2014 in West Africa. So we have to go back to those infectious prevention control, safe burial. Only those who have anything to do, who are protected, should be involved with the burial. It should not be a family thing. And then for now, we should stop all those family activities that could lead to the spread of the virus.
Given what you know about the capabilities of the health authorities in the regions there to address things like this, do you think there are sufficient resources on the ground in the affected region to contain the spread?
We're getting international help becomes important. Again, I think I want to go back to where we have our strength, which is the preparedness. We have so many epidemics. DR Congo has had 17 episodes of this disease. But now we should know that they should be aware of what is going on. To have to wait for 3 weeks before you make a diagnosis, something is wrong with our preparedness. And that's why we need to put our money. The simple issue of surveillance and all that is probably cheaper than having to get people to come in drugs and all that kind of thing. So Africa should refocus itself on the issue of preparedness, improve surveillance, so that we can prevent most of these outbreaks.
As you know, the security situation in the Democratic Republic of Congo, particularly in the east of the country where this outbreak is centered, that security situation is very precarious. There's civil war going on there, different kinds of conflict. That must make containment and treatment measures more difficult, doesn't it?
Oh, definitely. So we have two security issues. We are combating with the physical security. We're also combating with the insecurity of the virus itself. But meanwhile, remember where Ituri is. It's actually at the corner between Uganda and Southern Sudan. Nobody's even talking about Southern Sudan now because of the insecurity. Can't even get there. So who knows what is going on there? And these are contiguous areas. Remember what happened in Gedeku in 2014 when we had these three countries, Liberia, Sierra Leone, and others, getting themselves, So we maybe have the same kind of situation, but we can't even get there to find out what is happening, which makes it even more complicated.
Are you confident, Professor, that the international community will mobilize enough support to deal with this international emergency now?
Sooner or later, we better do, and the earlier, the better. Otherwise, the world will be at this problem. Again, I keep reminding you of what happened in 2014 in West Africa and became a major pandemic issue. So the same thing is happening now. And I think the earlier the international support comes in, the better for everybody and the countries themselves to come out and make sure that they put in all their resources into combating this outbreak.
And finally, Professor, just briefly, do you think that we could see cases of this outbreak, this particular strain, outside of Africa?
Why not? Why not? I mean, it started from where it was. They got it in Kampala now. They got a case in Goma, I'm told. There's in Kinshasa. So the world is at the beck and call of this Ebola virus. So the world better prepare.
Professor, thank you very much for talking with us today. That was virologist Oyewale Tomori.
It's a pleasure. Thank you.